lectures in pediatric dentistry, and I'll be taking up all the videos slowly and gradually what are related to the pediatric dentistry topic. So students, I'll be mainly focusing upon the dentistry subjects, and in the playlist section you can get a special playlist of mine where I'll be taking up lectures, I'll be posting videos related to dentistry. Now, so today's topic of the discussion is about the pediatric endodontics, where we are mainly focused on the endodontic procedures, that is the root canal procedures related to pediatric dentistry. So when the primary tooth is concerned, so as you all might be very well aware, particularly the dental graduate students, that when we look at the structure of the tooth, it is basically comprising of the outermost covering, that is the enamel. When we talk of the coronal portion, when we talk of the crown of the tooth, what we find is that the outermost covering, it is the enamel. Below it lies the dentine, which extends to the root as well, and the underlying the dentine, there is going to be present the pulp tissue. So it is the pulp tissue which is richly innervated with nerve fibers, blood vessels, lymphatics. There are so many nerve endings which are responsible for the pain perception in the tooth. So, and when we extend to the root portion, the root is out from the outermost covering of the root portion of the tooth. It is covered by the cementum, and below it is the dentine, and next we have the pulp chamber. So the entire tooth can be broadly divided into the coronal portion, that is the crown portion of the tooth, and below it is the radicular portion or the root portion of the tooth. So when we look at the endodontic procedures, that is the pediatric endodontics, when we are mainly focused on the primary tooth. So primary tooth are the set of the deciduous tooth what are present in the oral cavity. And so the today's topic, what I'll be focusing it is on the pulpotomy. So pulpotomy means we are mainly concerned with the pulp tissue, and otomy, wherever the term otomy is being added, means something is being cut down, something is being removed. You must have heard in class 12 biology that autotomy, mostly people say autotomy, which is mostly found in lizards, where a lizard is going to cut its tail by its own. This otomy, wherever the word otomy has been added, means a particular portion is being cut and removed from the main portion. So autotomy, it is found in lizards. Similarly, pulpotomy means the excision or the cutting of a particular portion, but not the complete removal. Wherever the word otomy is being added, it refers to the partial removal of a particular thing. And wherever the term ectomy, in the successive videos, I'll be discussing upon the ectomy as well. Ectomy means complete removal, otomy means partial removal. So since I'll be mainly focusing with this pulpotomy today, so pulpotomy means whenever there is an insult to the tissue, whenever there is any kind of a mechanical or a bacterial invasion of the tooth structure, and the carious lesion has extended either by the mechanical means, the tooth structure is getting damaged and it has invaded the enamel, it has exceeded through the dentine, and it has moved on to the coronal portion of the pulp. So the coronal pulp is going to be inflamed or infected. So what is to be done is, since only the coronal portion of the tooth is coronal pulp is getting inflamed or infected, so what we need to do is, we are simply going to excise. The partial removal of the pulp has to be done. So only from the coronal portion, the coronal pulp needs to be excised, needs to be cut off and removed from the pulp chamber. So the definition of pulpotomy as defined by Finn in the year 1995, Finn defined pulpotomy as the complete removal of the coronal portion of the dental pulp, followed by placement of a suitable dressing or a medicament that will promote healing and preserve the vitality of the tooth. Since we are only amputating the coronal portion of the pulp, we are preserving the radicular pulp. So that's why we are preserving the vitality of the tooth. Do remember, students, it is the pulp tissue, it is the living pulp tissue, it is the vitality of the pulp tissue which makes the tooth alive. So to maintain the vitality of the tooth, we are preserving the radicular pulp. So this was a definition where Finn has defined it as the complete removal of the coronal portion of the tooth, followed by placement of a suitable medicament, suitable dressing we need to give after the pulpotomy procedure. Within the pulp chamber, with a slow speed burr, we are going to excavate the caries. Once the caries have been excavated, with the help of a spoon excavator, the entire coronal pulp is being removed. And once the bleeding has subsided down, we are supposed to give a dressing, a suitable medicament over this pulp chamber to make the healing. In the exposed pulp stumps, the pulp stumps what are present, we are going to give a suitable dressing at the level of the pulp stumps so that we can preserve the vitality of the radicular pulp. Now, moving on to the next definition, according to the American Academy of Pediatric Dentistry, in the year 1998, they defined pulpotomy as the amputation of the affected, infected coronal pulp. It is only the affected and the infected coronal pulp portion of the dental pulp is being amputated, the amputation of it, and preserving the vitality and the function of the remaining part of the radicular pulp. So the remaining part of the radicular pulp, the remaining radicular pulp's vitality, we are going to preserve. So this was the definition what was given by the American Academy of Pediatric Dentistry in the year 1998. Now looking at the objectives, what are the objectives? Why we need to preserve this radicular pulp to be vital? Why this vitality is needed? Why the pulpotomy procedure is being carried out? So the first objective is that first in the process of pulpotomy, we are removing the inflamed and the infected coronal pulp. Only the inflamed or the infected, whether it be by any kind of the coronal pulp may get inflamed or infected by any kind of a mechanical insult, by any kind of a bacterial invasion. If the caries process has extended, crossing the enamel dentine and has approached the pulp, it has made the pulp inflamed, the pulp has got infected, there is bacterial invasion over there. So this all causes the coronal pulp to get inflamed and infected. So at the site of the exposure, and wheresoever this invasion, the bacterial invasion, this discontinuity, the tooth has the caries process, the destruction of the calcified tissues of the tooth has taken place and it has approached the pulp. So at that particular site, we are entirely going to remove the coronal pulp, and thus we are preserving the vitality of the radicular pulp. Do remember, students, beneath the primary tooth or the deciduous tooth, the succedaneous tooth or the permanent tooth germ is going to lie. So if this is the primary tooth what I have drawn, and just below it we have the crown portion of the succedaneous tooth or the permanent tooth germ, crown is being formed. So once the radicular pulp is being maintained, the vitality of this is maintained, so that is going to cause the proper timing, that will cause the proper eruption, that will give the permanent succedaneous tooth its natural environment to erupt peacefully. It will erupt in the usual trend. It is not the other tissues, the surrounding adjacent tissues are not being intervened just because we are not supposed to harm the succedaneous or the permanent tooth germ. So this was the first objective, and simply we are putting a medicament over here. So obviously we are putting something to heal. There is something, some kind of a dressing if we are going to put over there, we are going to heal that structure. We are going to heal this, the remaining, the pulp tissue. So moving on to the next main objective, the main objective is to maintain the tooth and the dental arch. Students, the dental graduates, do remember that the primary or the deciduous teeth are needed in the dentition. They are not supposed to be removed, they are not supposed to be extracted, because they are the natural space maintainers. If they are extracted at an earlier age, if the deciduous teeth are not being taken care of and they are not being treated, they are simply extracted, what is going to happen is that is certainly, they are definitely going to affect the eruption. They are going to definitely hamper the eruption of the permanent tooth, either in any way. The permanent counterpart, the permanent succedaneous tooth might be tilted, they might be tipped, they might be erupt at an abnormal location, their alignment in the arch might get distorted, might get displaced in the future dental arch. So in order to maintain the permanent teeth in the future dental arch at their normal physiologic position, these primary tooth needs to be maintained and they need to be treated. Now moving on to the rationale. Rationale, the word, literal meaning of the word rationale is the reasoning. So what is the reason behind? So when looking at the reason why this pulpotomy procedure is being carried out, it is that the radicular, we are just by performing the process of pulpotomy, by removing the coronal pulp, we are preserving the radicular pulp is healthy and it is capable of healing after the surgical amputation of the infected coronal pulp. And so this was the first rationale. The second rationale is it preserves the vitality of the radicular pulp. So the radicular pulp's vitality is maintained and we are not harming, we are not damaging the periapical tissues. We are not intervening there. Now, third point is that it maintains the tooth in the physiologic position. So once the deciduous teeth are retained in their original position within the dental arch, they are certainly, it is for the benefit of the succedaneous or the permanent tooth. They will erupt in the proper position, in their proper alignment, in the guided plane, in the guided position where they are supposed to be in the future permanent dentition. So students, this was a short video about pulpotomy. This is the Pediatric Endodontics series, and in the upcoming videos from the next video from this only, I'll be dealing with what are the indications and what are the contraindications when we are supposed to do pulpotomy and when we are not supposed to do pulpotomy. So students, stay connected, and if you do have any queries or comments, you're most welcome to comment me in the comment section. And students who are new to my channel and who haven't subscribed yet, go do subscribe my channel and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If still there are certain topics in dentistry what you want that you want that I should discuss in my, if you want to hear it from me, you're most welcome to comment me in the comment section and let me know. I'll certainly take up those topics and I'll discuss it. I'll prepare it and discuss it for you. So students, thank you for watching.